It's now my pleasure to introduce our next speaker, Mr. Adithya Menon. Adithya Menon is a popular Indian actor who stars prominently in the movies of various languages from the south of his country. He identifies himself as a rationalist and as a science enthusiast with a channel on YouTube debunking misinformation related to science. He is also an entrepreneur, set out to create a carbon negative soil amendment that reduces the need for water and irrigation. The title of his keynote talk is Living and Staying Healthy with Type 2 Diabetes.
Hi, I was invited to share my journey on how I deal with the diagnosis of my diabetes and what my lifestyle now is. However, unless I also share with you my observations of the populace around me, their actions, its influences therefore on me, and the reasons for my ensuing decisions, I feel I will not be able to present the correct picture. Forgive me if I talk about what may be obvious to you all. I'm merely trying to list out what I have understood. Despite the vast number of individuals suffering from diabetes across the world, the number of people who actually benefit from the advancements of modern medicine is abysmally low. While it is true that accessibility to science-based medicine is yet not universal, it is also true that in most places where it is available, it is not sought after. So who are these people who avoid science-based medicine and what are their reasons to shun it? I would think the reasons have to do with the success of the propaganda put forward by the alternative healthcare camps. While science-based medicine has watchdogs in the form of medical associations, keeping control on any attempts by doctors to advertise or promise remedies, the alternative healthcare camps are a free-for-all, indulging in campaigns that guarantee miracle cures and slander evidence-based, science-based medicine. India, for instance, even has a ministry dedicated to alternative healthcare called Ayush, and their patronage to such unproven systems, encouraging them to engage in procedures like surgery, has the Indian Medical Association finally protesting the proposition, calling for a stop to it. When it came to me, in order that I be able to make an informed decision, I took the time to read up and understand how each form of healthcare works. But the majority are those who are indoctrinated with the idea that modern medicine is harmful, it is synthetic, and that what the alternative camps offer instead are better because it is natural. To me, the confusion around the present COVID vaccination drive is an indicator of how misinformation on the workings of science leads to distrust. One might think that it is only the uneducated and those not literate in basic science who may fall prey to such misinformation. But I can vouch that individuals with college degrees in the fields of science like engineering have vehemently defended the idea that science-based medicine does more harm than good, and that herbal remedies and homeopathy is more reliable. I believe the solution lies in imparting credible information. The science-based medical fraternity should launch an effort to detail what other forms of healthcare really are, because under the garb of natural, which in itself is not true in many cases, these people withhold information about the foundations their systems rest on. I was fortunate enough to have parents who based belief on evidence and not faith. My maternal grandmother was diagnosed with diabetes when in her 40s, and despite having resided in a village back then in the 1960s, she had access to insulin thanks to her brother who was a doctor. My mother, when in her late 30s, was also diagnosed with diabetes and was on insulin replacement therapy for over 2 decades. Being aware of this family history, I have been cautious and detected pre-diabetic numbers at my age of 40 during one of my regular blood tests. Many of us Indians have a sedentary lifestyle, and other factors such as hypertension and cholesterol contribute to precipitating diabetes faster in those who are predisposed. I'm told that most of us in the country are diabetic because of insulin resistance, thanks to obesity. I have taken time to educate myself on how blood sugar works, how it's metabolized, glycemic indices of food types, and have been careful with my diet as careful can be. I also exercise as much as possible. My highest hemoglobin A1C in the last 6 years has been 6.4. I understand that a lot has changed over the years, and precision medicine is now available to suit the individual and the individual's lifestyle. I have been witness to the advancements and evolution of insulin, watching my mother traverse from Humulin 70/30 to short-acting and long-acting insulin. I have witnessed a friend who benefited from liraglutide and even managed to lose weight. If I could learn this, then others can too. Therefore, despite all the misinformation floating around, with the right intervention from the medical community, there is hope that more people could be made to understand the benefits of science-based medicine. I don't fear the illness anymore. I believe I am fortunate and will reap the rewards of all the hard work you are all putting in to get better at treating diabetes. I thank you all in the medical fraternity for your contributions.
Thank you for that wonderful talk. And we do have a question. How can doctors motivate people with diabetes to exercise regularly, eat a healthy diet, and take their medicines regularly?
From the last, I'm not sure if I'm audible, it just came online right now. So from the last talk that came in from Dr. Buse and his mention of one particular study by Ted Kaptchuk of Harvard about placebos and how it makes a big difference as to how doctors talk to their patients to teach and not to preach. I think therein lies the answer. Because most of the times what happens is when people talk to us, especially doctors, I know, I understand, because I've traveled various parts of the world, that doctors in different parts of the world behave differently with people who come in asking for care. Having said that, there is unfortunately an air of busyness where they're not in a position to spend as much time with the patient to give them the information they need. And often they're brushed aside and just told what to do. That approach is not going to help. So I guess at some point, the empathy with the patient to try and understand what he or she is going through, and then give them a solution based on that, would help them to exercise. And basically just to make them understand why exercise is important and why diet is important. I think a lot of people still don't know.
Thank you very much. Do you have any suggestions for us on how to approach individuals who are greatly influenced by misinformation on social media?
Well, for starters, I think there should be a concentrated effort from the medical community to put together a kind of organization which spreads the benefit of medicine and science. Unless and until people from the medical fraternity speak up and vouch for it, it's difficult to have people understand, because the other side is very strong and they have a lot of money now in order to keep pushing forward their propaganda and advance their interests. And the way they do it is to actually slander evidence-based, science-based medicine. It happens all the time. I hear it all the time. And whenever I interact with people, for instance, I'm not secretive about the issues I go through when I do. And when I do share it, the advice, and this is very Indian, almost everybody in India behaves like a doctor. They all have an answer to how to treat an illness. So, you immediately have people telling you how dangerous it is to rely on modern medicine because it's chemical and so on and so forth. So all this information is actually coming from the alternative camp. So the medical fraternity has to put their act together, get together and create an organization that spreads actual proper information.
Thank you very much. Those are wonderful messages for all of us. We greatly appreciate your perspective. We have another question. Diabetes changes across the lifespan as does social, political, and personal situations. Is education the key for better treatment, response, or control of media?
Education is very important because the media is going to keep coming up with conspiracy theories, whether you like it or not. But the one thing that can counter misinformation is if you get people to understand how diabetes actually works. A lot of people still don't know. I mean, for many years till I read up, I knew it has something to do with sugar. I knew my mom had kept some candies with her at all times, but I didn't realize it's because if she took extra insulin, she felt hypoglycemic, that she would take it. Now, these are information which a lot of people don't know. They don't understand how it works. So I would think education is the key. And as much as we have spent, for instance, now with the COVID pandemic, a lot of information has gone out there about washing hands and sanitizing and, keeping social distance, wearing a mask. I would think these kind of information on diabetes also needs to be made and sent out. I mean, diabetes specific, but it applies to all illnesses.
Thank you. And we have another question for you.
Yes, sir. Yes,
Would
ma'am.
a more precise diagnosis of the type of type 2 diabetes be helpful to you? Are you really insulin resistant? Would it be of help for you to know this? Thank you.
Absolutely, absolutely. Now the question itself, I mean, like a lot of us don't know why we get type 2 diabetes. Is it because I've become resistant, or has my pancreas stopped producing insulin? This is information which is really important to all of us. I guess based on that, we can take our steps based on the actual information. So if I just need to work out more and eat a little less of sugar, if that's going to help me reduce my carbohydrate, then I could do that instead of having to take insulin injections. Often, a lot of people I know have just been advised insulin without being told why they're being advised. And this is true. Though we have great doctors like Dr. Mohan in India, but we also have a lot of people who just want to get the people out the door and get the next patient in to make their money. So that's a difficult area to work with. But yes, that is important. I would think knowing what causes my diabetes will influence and make it much better.
Thank you so much. And we do have another question for you. My sense is that people from areas with high type 2 diabetes prevalence are almost desensitized to diagnosis. So many family members affected. How can we help highlight the serious nature?
Well, it's important that many of the illnesses which they develop post their contraction of type 2 diabetes is unknown to them. Like I know families, for instance, where someone's had issues with protein in the urine, proteinuria, but they don't realize it's because of uncontrolled diabetes. The family members are not aware of that either. They think it's part of aging, that people just get that anyway. Or for instance, people having to go through the laser treatment for the retina because they have, I'm forgetting the name, but that particular condition as well. Many of them don't relate this to being a reason of uncontrolled diabetes. And because they actually live through it and probably see old age, they presume that this is just part of aging and it's okay to be with it. And then, yes, the misinformation from the other side, we're just constantly telling you, just eat some herb and you should be fine, kind of adds to it.
And I think we have time for one more question before we go on to the next speaker. Type 2 diabetes is thought to be heterogeneous in etiology and response to treatment. In your own family, did you observe this heterogeneity?
I'm not sure because my grandmother passed away when I was really young. So I know she suffered from diabetes and I've seen her as a child taking insulin injections, but that's about how much I know about it. My mother's thing, once again, after she was diagnosed with diabetes, I had moved away to college. So it's been a little distant, but I'm trying to understand if you meant it's a similar type of diabetes which we all suffered, isn't it? That's the question. Am I right?
Well, so
when you meant heterogeneous, that's what you mean, isn't it?
Yeah. So but there are differences within type 2 diabetes. Have you noticed? Yeah.
Yes. So I would think it's the same because we're all been inactive probably to some extent, and that's the reason why we contracted this. And yes, there has been obesity in the family as well. So I guess it must be the same. I'm not sure. I don't have enough information on that.
Okay, well, thank you so much. Please keep your questions coming. We'll have a great panel discussion at the end where we can come back to some of these issues.
Thank you so much.
Thank you.